Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Centreville, Virginia, discussing the advantages of sedation dentistry and how it can help you overcome your fear of going to the dentist and virtually eliminate all pain with one of this area's top sedation dentists, Dr. Jose Aunon. Dr. Aunon earned his Doctor of Dental Surgery degree from Howard University and his advanced laser certification from the World Clinical Laser Institute. He is a member of the American Dental Association, the Virginia Dental Association, and the Northern Virginia Dental Society, among others. Welcome, Dr. Aunon.
Thank you. It's great to be here.
Oh, it's our pleasure to have you on. I believe this is your first time on A New Me.
Yes, it is.
Well, we've got a lot to talk about. So many of us have a fear, a great fear in some cases, of going to the dentist, even though we know we have to get treatments done to keep our smile healthy and nice looking. And I wanted to interview you today to discuss an option that can help us overcome that fear, namely sedation dentistry. And I wanted to ask you if you could please begin by telling us what sedation dentistry is.
Sedation dentistry is a great option for allowing the patient to overcome their fears of getting dental work done.
And what are some of its advantages and how it specifically works so we have an understanding of what sedation dentistry is?
Major advantage of sedation dentistry is being able to get all your dental work done in one appointment. So there's no anxiety, there's no fear or apprehension of having to come for multiple visits. You can get it all done in one visit.
Is there any, I take it, anesthesia that one would have to kind of put us under to a certain level?
Yes, there's variety of methods as far as for sedation dentistry. One is the mild form, or something that you breathe, and a nitrous oxide sedation where you breathe it and you get a calming effect. Another method is to take a pill before the appointment, and that calms you down considerably and be able to get your dental work done. Another method is to use a board-certified anesthesiologist, and basically he lets you go to sleep, and we get all the work done in one visit.
Oh, that sounds wonderful. So in other words, by having different work that we need done but are too nervous to go to the dentist, come to the dentist who's obviously certified to do sedation dentistry like yourself, and you can have multiple treatments done and not even realize or feel the pain or the nervousness or the anxiety and be under, so to speak, and then wake up without any pain, and we have our healthy smile back, or our beautiful smile, depending on what was done.
Correct. We get it all done in one visit.
That's very efficient for busy professionals out there.
Yes, it is.
Now, who would you say is a good candidate for this?
A good candidate would be somebody who's extremely anxious or has had past bad dental experiences. And typical patient is somebody who's been in a lot of pain, needs a lot of dental work, hasn't seen the dentist for 3, 5, 10 years, and at some point they reach the level where they are tired of the pain. They know that they need to get their mouth in shape. They're tired of not being able to eat. They're tired of being uncomfortable. So they reach a point where there's got to be some method for them to get their teeth fixed, and sedation dentistry offers that method.
Is there any age restriction or limit as to one who can undergo sedation dentistry, doctor, or do you have to be over 18 and under, say, 65, or doesn't really matter? There's
no age limit. I've done from 18 months old to 65-year-olds. So there's really the whole gamut of, if you're nervous, if you're healthy, we can do it here.
I believe you have some patient before and after pictures that you'd like to show us?
Yes, I do.
Let's take a look.
These are some pictures of some patients who their teeth have been neglected for so many years due to the fear and anxiety of going to the dentist. Once these teeth have been fixed, they've been able to live a better life, been able to eat properly, and have greater confidence in being able to smile without any anxiety or fear. The confidence is back, they can eat better, and they're much happier about their health.
Some very good results from what we just saw.
Thank you.
So from what we've seen here and heard here today, it's clear that sedation dentistry certainly helps us overcome that phobia that so many of us have from going to the dentist, even though we know we need to. It's sort of like death and taxes. I would say it follows right after that, right? As far as the nervousness and the fear that most people have.
Yes, it does.
Will patients have any memory of their experience when they're sitting there sedated and having undergone various treatment options?
With the medications that we use, there's very little memory of what has been done during the procedure. So the answer is no, they will have very little, if any, memory of what has been done.
Now, can they drive home after coming to you and having a treatment or treatments done under sedation, or is it recommended that they have somebody drive them home?
It is mandatory that somebody drives them home. There is not an option of being able to drive home after the procedure is done.
And how safe is sedation dentistry?
Sedation dentistry today, the way it's practiced, is much safer than it has been in the past.
And certainly the dentist would need to have the proper credentials and experience and training to perform sedation dentistry. Not every dentist is able to do that or should be doing that.
Yes,
based on their
there's
credentials.
extensive training that should be done for anybody to be doing sedation dentistry in a competent manner.
Your practice and yourself have achieved a reputation of excellence and are very widely recognized throughout this region as one of this area's top dentists, specifically within the sedation dentistry arena, which is your forte. I wanted to ask you, what sets you and your practice apart from so many of the others?
I've been doing sedation dentistry for 22 years, and my practice emphasizes personalized care. I will do your treatment plan, and I will do the work.
That's very good to know, especially in this day and age where unfortunately too many practices look at patients literally like a turnstile. I feel like a herd at the bank teller lines, and we've heard that from several patients out there about what they experience with other medical practices occasionally, and it's good to know there's still doctors and dentists in this case that emphasize personalized care, that you in this case specifically meet with the patients yourself, perform the treatment plans or options that they have done on them and that are available to them. And as far as board-certified anesthesiologists, I take it you utilize those?
Yes, we use board-certified anesthesiologists, and basically what we do is we turn in one of our operatories in our office into an operating room, similar to what you would find in any operating room at any hospital.
We certainly now have an option available to us if we didn't know about it already, namely sedation dentistry, and it certainly sounds like a wonderful way to get the dental work done that we need and overcome all those years of neglect of our mouth and our teeth and get that confidence, that healthy, beautiful smile back, and do it in a manner that helps us without the fear. We don't have that fear through sedation dentistry, and I'd like to thank you for joining us and being a guest on A New Me.
Thank you, Rocco.
It was our pleasure, and love to have you back sometime.
Thanks. Thank you.